Welcome back to the Recovery Series.
Today, we're diving into an incredible conversation with Dr. Caroline Rich. She is an occupational therapist who is bringing OT into home recovery for C-section moms.
From her own birth story to her groundbreaking research, Dr. Rich shows us why OT is the missing piece in helping moms truly heal at home.
This episode was so full of insights that we are breaking up into 2 parts, so be sure to tune in next week to hear the rest.
We really hope you guys enjoyed this episode.
Will you actually meditate with someone? Or teach them? Or I'm trying to this just seems too good to be true.
I know. So this is something I'm learning as well. I think that when I became a mom, I had done everything in the traditional medical model. And so after experiencing what I've experienced, have started branching out myself into more holistic type of treatments. And so anytime I learn something, I'm like, let's do it,
Yeah.
I'm not an expert by any means in meditation, and not from a spiritual side of things, but I use an aura ring. And so they have incorporated in that, I think it's Headspace. I forget which app it is. I've done that with plenty of patients, of pull up my Headspace app and let's go through a 5-minute body check, where you just are, I'm more guiding the person into and then listening to something, because I don't have training necessarily in that space, but I've seen such a benefit for myself when I feel like my stress levels are rising, or I am in more pain, or, I get migraines. And oftentimes I realize in the day I'm clenching my shoulders up, and just those body checks to okay, take a deep breath, calm myself down. Everything I'm learning, I'm just incorporating with my patients, and I've seen such a benefit. So no, I don't have specific training.
No, I just curious. No. It's so great.
Well, I think the thing about meditation is that you don't really have to, I have no training in it, but it's my self-training that I know something that I've done for myself has worked. So why not pass that information along? Why not pass that knowledge along?
Yes,
and
absolutely.
With the resources, there's so many apps now that can take you through it. So it doesn't have to be so complicated. It's something that can be so simple. And breathwork is something, Jen and I talk about all the time. I truly believe if you can just have a grounding breathwork that you do for yourself, it's what you need every day. I do one every day in my life. There's always a moment of my day, maybe it has nothing to do with my children or anything. Maybe someone just cut me off, and I'm not going to flip them off. I'm just going to force where I breathe, And then I'm all right, I'm not going to let them ruin my day with that, So it is, there's skills that we can take through every motion of our life is something as simple as breath work.
Absolutely. Yeah. That's something that, again, I don't have specific training in, but I'm so interested in, because I have seen such benefit for myself, and just grounding, breath, walking barefoot outside, I'm learning a lot about the vagus nerve, and which goes from your brain, down to your digestive tract, and how, talking about constipation after C-section or surgery, all these things, if you can get in that rest and digest state and calm the vagus nerve, not that you can't take medication, all of those things, but looking more at a holistic view that is for lifelong healing and help. And craniosacral therapy is a huge type of therapy that really helped my daughter and has helped me with my migraines. I'm really interested in that training. Yeah, just really learning how to ground yourself throughout your day. It doesn't mean you stop any stressful situations. We live in a stressful world, but how can you do check-ins throughout the day, whether you're in those acute postpartum days or you're in the toddler years and there's tantrums and whatnot? How can you calm yourself? Because that's so therapeutic to not only yourself, but your kids, your whole family. If mom's healthy, everybody is happy.
Totally. Which goes back to why having OT early on is so important, because let's face it, we are the strength of our families for most homes, the mom's the pillar. The mom is the one who keeps everything going. And if we crumble, everybody else is going to crumble.
And
absolutely.
And the idea of coming to the home really just
takes a huge piece of stress out.
Huge part of it.
Yeah.
And then do you also we'll do mental health screenings of some sort, correct?
Yes, absolutely. I think that is so important. And I remember at my daughter's pediatrician, I would be given, that depression screening at every one of
that actually,
her visits. But then I don't know what they did with them because I was never
I think I
talked
lied
to.
too.
I
think
know.
it was just paperwork
It's
that they were
okay.
like, okay, she passed, throw it away now.
Yeah, I was like, how do I
Exactly.
make this seem legit? Like,
Yeah.
Yeah, exactly. So that's the difference of like, yes, giving screenings in standardized screenings, but also getting a sense of just through the conversations at every visit, like how, you may lie on your sheet that you fill out because you don't want to be like, well, I'm the person, that
I'm like,
has,
I just want to
shouldn't
get
be dealing
home,
with
get back
this.
home.
Mhm.
Yeah.
Yes, exactly. And the importance of knowing that those postpartum mental health concerns can come up anytime in the first year. So just the first, obviously, we're talking about the acute postpartum stage, but giving moms just language, I think, around like what you're looking for, what are the red flags? Because that was something in my experience that I had never had depression before, so I didn't know what I was looking for, and it can show up in so many different ways for different women. The early days of saying, like, you may not feel this way now, but I want to educate you on if you start having XYZ symptoms, these are some red flags that you can catch this really early on before they snowball into like a full blown crisis. I think that is just so important and something I so wish I had had because I'm convinced, first time you don't really know what you're doing and you're trying to figure things out. And I was dismissed so much because, like, oh, honey, you're the first time mom. Like, these are normal, and that just like now, I mean, at the time it like shot me through the roof, but now I'm like, oh, it just makes me so angry because you know your body, you know yourself better than anybody.
Totally.
And all I was given was here's a list of some counselors in your area and the mental load to call these to see if they took my insurance, to explain what I was going through. Like that alone, I was like, I don't have the energy to do this. So anyways, I could get on the soapbox all day about that conversation.
That's a really, really important soapbox to be on because you're right.
Yeah.
It should be more of that word, the mental load. I mean, how many things have we even now taking care of myself, and I'm getting like a mammogram tomorrow, by the way.
Good for you.
I've been talking a lot about turning 40, but it's like usually there's so many things that you don't do for yourself because of all the hurdles, all the things in the way. And especially if you're already feeling overwhelmed, and this is why you're seeking out help to begin with, adding another thing to your plate, it can prevent people from getting the help they need. So especially having someone actively seeing you and reaching out to you and saying, how are you feeling? And maybe the first time you say, okay, and then asking again, is that something that you would be able to do in your role? Is if, let's say you identify someone who seems to be needing some kind of counseling, therapy, whatever it is, that you could facilitate that in some way for them?
Definitely. Definitely. I think that would be a huge role of, I'm not necessarily I'm not a mental health therapist, but we do within OT have training on mental health and more so like, how does this impact with your daily living? And there are OTs who are trained more in mental health, but that's, a huge part of what we do is connecting people to the right resources and seeing like, okay, this is a red flag and this maybe where it's getting out. Maybe there are things in those early stages. Actually, not maybe. There's definitely things in the early stages that an OT could reduce the mental load. So maybe they never need to go to a mental health counselor or medication.
Reducing the mental load.
Right. And
because that is what I am trained in,
And let's just face it, everybody's going to be more honest about their feelings when they're in the safe space of their home versus being in the pediatrician's office. I just remember I was so laser focused on the well-being of my child that even they were asking me questions, I wasn't answering them honestly because I'm here for him. Like I can't do both at once right now. That took so much energy. So yes, to have somebody in your home ask you how you are truly doing, how you are truly coping. Are you feeling these sensations that don't feel right? And you're right. It's like we have that gut feeling. We know ourselves so well, but it's just being honest about it with a safe person that's so important.
Yeah, I know for myself, when I was transitioning out of breastfeeding and I had that oxytocin drop, my body and hormonal rebalancing, I would wake up in the morning and have like really jittery feelings. Like I was like, I don't know what to do with myself. I think about in that moment, if I had been there, another OT had been there, okay, what can we do? Let's get you outside in the sun. Let's go for a walk. Let's, environmental modifications
Hmm.
that it wouldn't have necessarily taken away those jittery feelings that the hormonal rebalancing was causing, but there are lifestyle adjustments that could have helped me cope with, just somebody else, even though they're very simple strategies. I think when you're in that mindset, just somebody on the outside who you view as a professional, but somebody who's safe saying,
Right.
I hear you. I'm with you. Like, let's try this. And then if we meet, say, when we meet next week, if we're still having those jittery feelings in the morning, like, okay, let's call your OB. Let's see who else we can bring into this conversation because maybe there's more playing a part. Let's look at your blood work. Let's look at, what's happening. So, yeah, I
So,
think that the mental health piece is huge.
Yeah.
so about the collaboration with the OBs, since I
Hmm.
know this is kind of a new concept, let's go back to the hip replacement person. In
Hmm.
what ways are you able to communicate with, let's say, the orthopedic surgeon or I don't know, their primary care doctor? Is there already a system in place for other scenarios for collaboration communication with the patient's physicians? Because I'm trying to think how we could, like, how would this
Right.
look in practice?
Yeah, yeah. So OTs, most professions in home health all work, I think every single one I can think of, unless you are a physician, work under physician orders. So we have to get an order. We can't even go in the home health model. You can't go to somebody's home or initiate that process without an order from a
It's just
physician.
kind of like a prescription, right?
Yeah,
Right.
Yes.
exactly.
Yeah.
Exactly. So they're saying like what therapies they want. So when we get for somebody to start home health in the traditional setting, it's going to be a doctor saying, what is the main diagnosis
Mhm.
and what services do I want this patient to be evaluated for? Oftentimes, nursing, speech, PT, OT, social work. Those are what we have on staff. And so in this population, it would be the OB writing an order for this client, this mom to get our services. And then every time, then you do your evaluation. And then we always have to call the doctor back and say, okay, based on my evaluation, you gave me orders to do the evaluation. I've done my evaluation. This is the personalized plan of care that I think is best for this patient. Will you sign these orders? And then we
For
send our
continued
evaluation.
kind of care.
Yes,
Mhm.
exactly. We send our evaluation and what our goals are, what we hope for this patient to meet. The physician signs off on that. So they've agreed that they're going to sign all these orders and this patient is under the provision of their care. So it's already established before you even start seeing somebody that this is going to be like we're going to have a back and forth relationship about
You're
this
going to kind of
patient.
give like progress reports of some kind.
Yes,
Yeah.
exactly. Are they meeting their goals? If we've written asked for orders that are, say, twice a week for the next 4 weeks, and there's two ways or three ways, I guess, it could go. Say you're 2 weeks in, and this patient has met all of their goals, and they're living independently, because I don't think I ever touched on this in home health. The whole point of it is to get people as safe as possible in their home and avoid reentry to the hospital.
Right.
And to be able to, their graduation is, in most cases, to be able to live their life again without support. Or if they have somebody in the home, they need support, but they've got all the resources they need. So, say 2 weeks in, they've met all their goals. They're like, I'm really doing well. I'm ready to go to outpatient, because you can't do home health under the insurance model. You can't do home health at the same time as going to outpatient. So, I'm ready to go to outpatient. At that point, I would call the doctor and say, hey, this patient, team with all the other clinicians that are in, make sure we're all on the same page. This person's ready to go to outpatient. We're going to write a new order to discharge. That would be like a scenario. Or you get to the end of your 4 weeks and they need more time. That's another conversation with the doctor. Hey, we've met these goals, but we still have XYZ to go. So it's a constant back and
Yeah.
forth.
And as far as that advocacy piece, I mean, hospitals don't want readmissions.
Right.
Yes,
It
it's
looks bad.
expensive.
It's expensive. And of course, there are readmissions for women after C-section, but there's also, I mean, a lot of ED visits, a
Yes,
lot of
exactly.
emergencies that I probably could be avoided
Yeah.
for various things. I mean, I see that all the time. Maybe I just don't know about the readmissions if they're not coming back to labor and delivery, but all the time I know women come back with concerns and most of the time, I think they're not readmitted actually, and they didn't really, and that's expensive. It's time consuming. They're coming to leave their babies. I mean, it's a whole thing that if we could avoid many of those with this home health, that's obviously the best thing.
Yeah, absolutely.
It's probably some work for the OBs. I'm just also trying to think of this from a really practical standpoint.
Well, that's what I was going to say too. Like you're creating the action plan, but the OB
is just sign off on it.
It's just signing off on it, right? You're doing the thinking of who you're collaborating with. It's just getting the OB to sign off on it so insurance is on board.
Do you know how there's some OBs that don't take insurance? I'm thinking like I did my training in New York City, so I'm wondering if these, it's like maybe just start somewhere with the people who are giving the most VIP type of care. Like, are they doing this?
Even thinking about like MFMs, I mean, those they're seeking, they have patients that probably
coming in high risk,
right? Even more so would need some OT after a delivery.
Yeah,
it's just like we have
and
to start.
You can start anywhere, and you can be in network with your OB. But a lot of the services I've personally found are out of network providers, which is a cash-based practice. But you can still, and that's something that, I would love to incorporate, is you can submit super bills for your out of network benefits, and everybody's insurance plan is different. But insurance plans don't, they really encourage in-network. And so there's not a lot of resources around figuring out how to utilize your out-of-network benefits, but they are available.
They are there,
and
right? So you have to ask about that too.
Oh,
so
I will.
What if I go to someone who's out of network, maybe how much of it will you cover? Do you cover out of network?
Yeah, because I have, for personally, which I have gone through like so many phone calls with my insurance to figure this out. And now I think there's a much more streamlined process to do it that I would love to help other women with, or other people in general. But I submit all of my super bills, and once I hit a certain deductible, I have to pay out of pocket first, but then they reimburse me 70%, and I get checks in the mail or direct deposit. And so that is an area that I think is not talked about either.
This could be part of your Instagram account or social media, because I need this information.
Yes.
And I'm sure so many people do. And whenever Bethany and I talk about insurance, I have such a disdain for the whole process that I've purposely been a bit ignorant, because I don't think about it. The type of doctor that I am, I work at a hospital. I take care of the patients that arrive at the hospital. People will ask me about my, it's just, I don't deal with it. I don't deal with it at all. But it's so important. And as things change too, understanding, it's just such a hot topic right now. And if you have the knowledge, please share. That's all I'm saying.
Yeah. I definitely will. And as I think, policy changes and everything trickles down, because Medicare creates all of the guidelines for all the private insurances, and with how many changes there are in the political scene, like that can affect all the private insurances too. What I have seen, at least, is a lot more really good practitioners moving out of the traditional model.
This is the trend. This is what, yes, because everyone, as doctors, we're putting our foot down. Again, doesn't really apply to me because I'm working in a hospital, but the direct primary care model, everyone's saying this is how we're able to best take care of patients. And private insurance isn't free either, by the way. I've been so frustrated with my insurance because I feel like it's so expensive, and then I'm still always paying for things. Like what, So if everybody moves outside that model and finds a way to make it not free, but again, insurance isn't free either for private insurance for the most part, that's the way of the future for sure. There's going to be a lot of changes in our healthcare system.
Absolutely. So learning to navigate, like you are paying all of this money monthly, and it's oftentimes, taken out before pre-tax. So a lot of people don't pay attention to it's like, okay, well, this is just, I have insurance. Then when you look at what's actually taken out, so absolutely they should be reimbursing
so sad.
you.
Yes.
Absolutely. They should be reimbursing you for these out-of-network costs, because it's the same as them reimbursing an in-network provider. It's just a set rate that in-network provider has. So that's definitely an area that I want to include in my consultation services.
Yes.
Do you know anything about Medicaid? Do you know anything about Medicaid and home health? Because you mentioned that Medicare covers home health well. Do you have any idea
Yes.
about Medicaid? Just curious.
So I have had patients who, because to be honest, I don't know. I feel like it's very confusing.
It's
It's
confusing.
so
learn.
confusing.
It's okay. It's okay. I
But,
obviously
you
really
know,
don't know, but I do know there's some coverage thing that changes during your pregnancy that you can then lose it after.
Yes.
Yes.
And that's why I feel so strong. We're really involved in my husband and I in our church in the foster care ministry, like in our local area. I know a lot of people who utilize Medicaid, but that's about as far as I know.
Okay.
And it's frustrating because seeing like the lower income populations who typically need or on Medicaid, like this is difficult. All of these things we're talking about, motherhood, post C-section, all these things are so difficult for like middle upper class people who have resources,
Right.
And so that's something that with the advocacy part, like mine will be when I launch my business, a private out of network cash pay business, but you're missing such a huge population of women who have no resources. They most likely don't have that support at home. They're getting none of these services.
Going back
And
to
so
work right away.
Yeah.
Going back to work, no leave.
Yeah.
Yeah, I want to learn more about it and how the advocacy piece there, because
we
it's
support
really
you.
confusing to
Yeah.
me.
100%
Thank
in
you.
that. We can't wait to see what you do.
I know.
And
We're
this
going to have
business
to
that you're gonna
revisit this
create.
conversation once you get your business up and going.
Yes.
Once I
yes.
talk to Tom at the insurance company.
I have a lot of
Yes.
ideas for you.
I know. Send them my way. I'm all ears.
I do. I really do. So we're going to wrap things up. Bethany, do you
Yes.
have anything you want to say?
Well, I do, because and I love, I didn't speak to you before we met, only Jen and you
I
connected.
talked to her for like an hour.
I didn't realize that you were also into the holistic
Oh, yes.
world, and that you love
Yes.
to integrate nature and all of that.
She's
and
a
I'm
natural partner for us.
and I'm all about that. So I put together a mantra for you, because I always think that it's important that when we give out, that we replenish ourselves as well. So if you would like to join me, I will say everything. And then if you just repeat after me, you can close your eyes if you want to, or keep them open, whatever feels best for you. I am reshaping C-section care.
I am reshaping C-section care.
I believe every mother deserves to feel seen,
I believe every mother deserves to be seen,
supported, and strong.
supported, and strong.
I advocate for dignity and care at home.
I advocate for dignity and care at home.
I am on a mission.
I am on a mission.
I am motivated.
I am motivated.
Yeah.
Please
you.
keep motivated. We are so thrilled with what you are putting out there and paving the way for something that is so vital to every mom, C-section or vaginal. You need the support at home, and to feel this type of love and support is just so huge.
Thank you. I so appreciate you all.
Yeah, this is a huge missing piece. I think we're trying to piece together there's so many gaps.
Right.
And everything that we talk about, from prenatal education through the birth experience itself into recovery, and you are filling a massive gap with this. So we wish you all the best.
Yes.
And
Thank
yes,
you
we'd
so
love to have you on
much.
again.
Yeah.
And
Yes, I
thank
would love
you
to.
so much for joining us, everybody. We'll see you next week.
Bye.
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 Bye.